Dr. Fatah. I'll just dash through this. Not chaining. Okay. So these are the intended ILOs to understand classification and how they are named, cell cycle and control mechanisms, and main cellular changes in the cancer. A definition, I think I'll just quickly go through that we all now know what is a neoplasm, what is a neoplasia, what is a new growth. So it is an abnormal mass which exceeds and uncoordinated. It keeps on increasing. It's more than the other tissues, and uncoordinated means it is not in coordination, not going together. And third important point is it persists in the same manner after a removal of stimulus, because we know that some of the cancer, we don't know why they happen, but in some cancers, we know that it happens. Like example of smokers, we know in smokers, people get lung cancer, but I think where is the pointer? Laser pointer. Okay, so in the smokers, there's lung cancer. And when someone is diagnosed with lung cancer, doctor says, okay, mister, you don't smoke anymore. So if he stops the smoking, but lung cancer says, no, I will keep on growing. So it persists. It keeps on growing even after the removal. And this example of growing baby, normal young baby grows properly without any exceeding whenever the hormones are removed at the age of like 17, 18 to 19, 20 years. It stops growing. There's coordination between right limb and the left limb, fingers and everything, face, nose, ears. So there's coordination. So I just thought I'll give you these simple examples. How can we classify it? I thought I'll ask you the question, but let's see. If we are sitting in this class, about 100 students, 100 people, how will you classify this? Okay, can anyone answer? Anyone? It's very difficult to say one. How will you classify your classroom? On the, yes, on the basis of age, mashallah, some may be greater than 20, some may be less than 20, and one is more than 60 years, okay? So you'll try divide it. Then on the basis of sex, some are males and females. You can divide them on the grading. Some are A grade students, some are B grade, like that. So here also tumors can be divided or classified in many ways. Behavior, tissue of origin, site of origin, whether it's primary or secondary, grading, low grade, high grade, and receptor. Dr. Zainab must have told you the hormone receptors, which we apply in the breast cancer, are the ER positive, estrogen receptor positive, progesterone receptor positive, or Herceptin receptor positive, or they're triple negative, whether they're basal. So classification can be done in many ways. But for second year students, in a simplified way, we name them in only two main things. These are the most important ones. One is the behavior. On the basis of behavior, we can call them benign tumor or malignant tumor. And on the basis of tissue of origin. These are the two important points of classification. For classification and nomenclature, means naming of the tumor is also done on the basis of behavior and tissue of origin. Tissue of origin can be epithelium, connective tissue, lymphoid tissue, blood, etc. So we'll do these two. So on the basis of this, we divide them into 5 classes. First is benign tumors of epithelial tissue, benign tumors of mesenchymal tissue, malignant tumors of epithelial tissue, malignant tumors of mesenchymal tissue. And we put the remaining in the miscellaneous group. We call it miscellaneous group, in which we have the lymphomas, leukemias, teratomas, nerve tumors, etc. are in the miscellaneous group. So the first main group is benign tumors of epithelial tissue. We put an OMA. I think you have been told at the end of benign tumors, we put OMA. OMA actually comes from the word tumor. So we put suffix means at the end. Prefix means in the beginning, so suffix is at the end. So we have tumors arising from the surface epithelium are called papillomas. Anyone knows why it is called papilloma? 1, 2, 3, 4, 5. Papilloma means finger-like, okay? Papilloma means finger-like. So these are benign tumors. They grow like finger-like processes from the surface epithelium, from the surface. So if they are appearing from the squamous epithelium, squamous cell papilloma, transitional cell, you know where is transitional cells in the body? Normal?
It's a sensation.
Transition in the, sorry,
Okay. For
where?
sensation.
Transitional
Usually,
cell
urinary
in the
bladder sometimes.
urinary bladder, in the urinary tract. Yes, mashallah. So transitional cell papillomas arise in the urinary tract. Basal cell papilloma arise from the skin, but very rarely. So skin has, you know, basal cells, polyhedral cells, and at the surface we have squamous cells. The basal cell papilloma is a benign tumor arising from the basal cells of the skin. Coming to the glands, if they are just simple glands, tumor, benign tumor of the simple gland, we call it adenoma, NOS, not otherwise specified. I just mentioned this because sometimes you may come across this word. Anyone knows what is NAD? NAD. Have I heard of this word? NAD. In the ECE?
Non-disclosure agreement?
No, it's when you examine a system, like you say that cardiovascular system is NAD. No, it's nothing abnormal detected. So that is a word for, from the ECE. So adenoma, NOS means it is a simple adenoma. And sometimes these benign tumors are mixed. They have two tissues in it. Like fibroadenoma, as the name is suggesting, it has a fibrous tissue and gland tissue. So it is fibroadenoma. Then there's a pleomorphic adenoma. Adenoma means benign tumor of the glands, and pleomorphic means multiple morphology. Morphology is multiple. Pleomorphic means irregular morphology. This occurs in the salivary gland. We'll see the picture in the next slide. And when there are gland-like spaces, cystic spaces, we call them cystadenomas. So this is the classification of simple benign tumors arising from the glands. Simple adenomas, mixed adenomas, and cystic adenomas. This is a picture of a mixed tumor. It has both epithelial component and a mesenchymal component. We call it fibroadenoma of breast. It's the most common tumor of the young ladies, breast tumor, very common. And it is called breast mice. You know what is mice? Mouse? Mouse of the computer, and the mouse and animal, Mickey Mouse. Okay? It is called mice because it is benign tumor. It is very small, rounded structure. And it because benign is not fixed to anything. So because the breast has fat, also soft tissue. So you try to hold it, to palpate it, it is difficult to catch it. So that is why it was named as breast mice. Because as pathologists, we had to do the FNAs of these neck swellings and the breast swellings and anywhere. So we do them regularly and it breast tumors. So when we try to hold it, it's difficult to hold. So we call them breast mice, mouse. They have glands and fibrous tissue. The glands are, because of the growth of the fibrous tissue, the glands are compressed. They are elongated and compressed. So it is fibroadenoma. Then pleomorphic adenoma of the salivary glands also has two tissues. One is the glands, these are the glands, and between them is fibrous, myxoid, cartilage. So it's a lot of mixture is there. So that is why it is called pleomorphic. It is very irregular type. The glands are benign, and this is also benign, but it's growing. So when it is growing, it will compress the gland. So glands are elongated and slit-like. So this is a tumor in the salivary gland usually. It is called pleomorphic adenoma of the salivary gland. It contains glands and fibromyxoid stroma. Cystadenomas, they can occur in the kidney, they can occur in the liver, many other organs. They have these large spaces, cyst-like spaces, balloon-like spaces. So that is why they are called cystic spaces. You did one of your case was, I think, I'm not the tutor of year 2, I'm in year 3. So someone told me you did cystic fibrosis in pancreas. You know, did the case of cystic fibrosis? So in that you see the cyst and fibrosis in the pancreas, cystic fibrosis. Then we come to the second group, benign tumor of the mesenchyme. Mesenchymal tissue or connective tissue. Again, the suffix is oma. It's simple. Lipoma is the tumor of the fat. Lipid is the word for the fat. Adipose tissue, all these are the words for the fat. And the tumor arising is called lipoma. Similarly, fibroma from the cartilage, chondroma from the bone, osteoma. Now, this picture is of osteoma. Now, to a pathologist, if someone comes with a, Rami brings a slide to me, says, Dr. Akbar, please look at this slide. It is of my friend. He has some lesions. So this is the slide. So when I look at the microscope, I will say it is normal bone tissue. So we cannot differentiate a normal bone tissue from an osteoma tissue. So it's especially in the bone cases, we need to see the X-rays also to see is there any tumor or just from the normal tissue. So like here also, you see this is the normal bone around, and only here is the osteoma in the center, rounded structure. If we take tissue from here or from here, it's under the microscope, same. We cannot differentiate. So it is very important. That is why 2 more slides related to it for your clinical practice. It is important. I will tell you again. Tumors arising from the muscles are leiomyoma from the smooth muscle, rhabdomyoma from the striate muscle. Where in the body are, sorry?
The يعني carcinoma right side only.
Right side?
Okay.
No, I have not said right side. I'm sorry. Maybe because of, anyway, we have not come to the carcinoma. These are the benign tumors of fat, fibrous tissue, cartilage, chondroma, bone, osteoma. Under the microscope, this is just like normal bone. You see a histology slide bone taken from like say humerus or femur or somewhere, it will look like that. We cannot call it osteoma till we see the X-rays of this patient also. Only then we can say that, yes, it is taken from the osteoma. Again, muscles, leiomyoma from the smooth muscle, rhabdomyoma from the striate muscle. You know where is the striate muscle in the body? 1, 2, 3. Skeletal muscle of the body are all, yes, all striated, and the heart muscle. Yes, very good. Mashallah said 2 types. Striated muscles are in the all the musculature of the body, limbs, muscles, and thighs and body, and heart muscle. They are striated and they are rhabdomyomas. Now, this is the important slide I wanted to show you because of the practice. This is a case of lipoma. If someone gives me a slide, my good student, suppose like brings a slide to me and say, Dr. Akbar, you are a pathologist, look at it. I'll say, just look at this slide. I say, it's normal fat. She will tell me that, oh, doctor, it was, my friend has big tumor and from that it was taken. Then I say, if it was taken from the tumor, then we call it lipoma. But if it was taken from here, like from just the subcutaneous tissue, it's a normal tissue. So sometimes it's important as doctors, you are sitting in the surgery, in the clinic doing some surgery in the operation theater, you have to fill the form properly. We cannot, sometimes we come to big problems as a pathologist to give you the correct diagnosis. So it looks similar as a microscope, similar if you take it from here or from here. These are the small lipomas in this patient. So this is very important. Similarly, I wanted to show you this case. Again, a very common tumor of the females. You have done this case. You know what is this? Uterus, okay? This, yes, this is mashallah uterus, and this is the cervix and the body of the uterus. These are the 2 appendages with fallopian tube and the ovaries. And these are the tumors. These are abnormal things inside and then in the wall and outside. Accordingly, they have their name like submucosal, intramural, and subserosal. They have different names. They are also called fibroid, but because they are more like fibrous tissue. All under the microscope, they are muscle, but because of thick compact structure, grossly when you cut it on gross examination, naked eye examination, they look like fibrous tissue. That is why more commonly they are called fibroids. Taking the example of heart attack, we know a heart attack, they call it heart attack, actually it's myocardial infarction, but everyone calls it heart attack. Similarly, it is called fibroids. These are the leiomyomas, muscles, the tumor, smooth muscle tumor, benign tumor of the uterus, most common in the females, very common. So again, I have the same problem as a pathologist. Someone brings the slide to me, Dr. Akbar, look at this. I will say it's just smooth muscle fibers. If they are taken from this part, I will call it leiomyoma. If they are taken from just this part, we'll call it normal uterus. So this is important for your life lesson, because even after so much experience, still we get the same problem that people, they just don't fill the form properly and we don't know what the slides are. Okay, even UK it happens. Some people, they don't fill the form, or especially the junior ones. So I thought this important point I should tell you. Now the third group is the malignant tumors of the epithelial tissue. Here we put carcinoma at the end. Squamous cell carcinoma, transitional cell carcinoma, basal cell carcinoma. If they are appearing from the surface, arising from the surface. If they are originating from the glands, we call them adenocarcinoma, NOS, not otherwise specified, simple ones. If they have cystic spaces, we call them cyst adenocarcinoma. Cyst adenocarcinoma, they are usually common in the ovaries, more common in the pancreas, etc. These are two important places of cyst adenocarcinomas. So this is a picture of, I think it came like that. Adenocarcinoma, these are the glands again, irregular glands, but they are lined by all these very bad looking cells, abnormal cells. We'll see more in detail now. They have dark color, irregular nuclei, some mitotic figures also, which in high power we'll say. So these are glands. This is the colon in the intestine, and this is the tumor, the ulcerative tumor, adenocarcinoma. From that, you make a slide, you see under the microscope, these glands, malignant glands, adenocarcinoma. This is the amputation specimen. Amputation, you understand? Complete removal of the upper arm. So this is a bad tumor here. So such a big tumor, patient did not care and kept on growing. Maybe he had got lymph nodes in it, metastases in the axilla or in the body or the lungs. So they have removed the whole right upper limb, okay? So this is under the microscope. These are squamous cells. These are squams, squamous cell carcinoma of this tumor. The basal cell carcinoma, you usually occur on the face. This is an old lady. You can see this is the tumor, very ulcerative. I think this picture was you have seen this picture in the previous lectures. So this lady, as tumor is growing very fast and causing ulceration and destruction of her cheek and maxilla bone and mandible bone, skin, everything is destroyed. And under the microscope, you see mainly basal cells are dividing, basal cells. The cells at the base, they are dark and they are dividing. This basal cell carcinoma. And I told you an important feature, very important feature of this basal cell carcinoma is that this tumor grows here. Locally, it is very destructive, killing. But it does not kill the patient. It just destroys locally, and it has less chance to metastasize. It does not go into the blood and into the liver or lung or brain. It is less chance to metastasize, but only locally aggressive. Even it is called carcinoma. We know that the carcinoma, they go into the blood supply and go into the lymphatics, to the lymph nodes and the liver and lung, etc. But this tumor has a special property. It is locally destructive and less chance to metastasize. Fourth category is malignant tumors of the mesenchymal tissue or the connective tissue. We call them sarcomas. Did Dr. Murad tell you what is sarcoma? Anyone knows what is sarc? It comes from which word? Any meaning, mana of sarc? It means fish, okay? When these tumors, they grow, when you cut them, it look like fish flesh, fish, stomach. And according their names are same: liposarcoma, fibrosarcoma, cartilage chondrosarcoma, bone osteosarcoma. Now the point is, there are many other tumors also. Just as a undergrad students, I think it's simple, but there are osteogenic sarcoma, there's osteoclastoma. Just remember, osteosarcoma is the malignant tumor of the bone, osteosarcoma. There are many other types also. From the muscles, this is leiomyosarcoma. Here I wanted to show you this picture that they are mitotic figures. You see this mitosis with 3 poles. There are 1, 2, 3. Here are again many mitoses. There are many mitotic figures in the leiomyosarcoma, the muscle of the smooth muscle, the malignant tumor of the smooth muscle. Then the striated muscle will give rise to rhabdomyosarcoma. Is it clear? Am I going fast? Should I go slow? Thank you very much. Jazakallah khair. Alhamdulillah. So we go to the next slide. Just a simple, quick comparison. If the tumor is arising from squamous epithelium and it is a benign tumor, we call it squamous cell papilloma. If it is a malignant tumor, we call it squamous cell carcinoma. If a tumor cell tissue of origin is glands, glandular epithelium, it can be called as adenoma and cystadenoma if it is benign, adenocarcinoma or cystadenoma if it is malignant. Smooth muscles, leiomyoma and leiomyosarcoma. Skeletal muscle, rhabdomyoma and rhabdomyosarcoma. Now this is something exception. There are always exceptions, you know. There are some different, something away from the normal. People call it outliers. Like in your class of young teachers, one young students, there's one outlier of 60-year-old. Okay. So similarly, this is easy. The first are easy, but here you come to a difficult thing. What is nevus? Nevus is very different. It's not an oma. It is not a it's not a carcinoma, sarcoma. It's just written nevus. It is a benign tumor of melanocytes. So there's abnormality. So melanoma again, we'll come to the next slide. After that, the melanoma looks like the name says, it's look like benign, but it's not benign, it's malignant. Melanoma is a malignant tumor of the melanocytes. So these are called misnomers, these are called abnormalities, these are called special names. Finally, the 5th group is the miscellaneous group. Here again, you see the problems. If the tumor is arising from the lymphoid cells, from the lymph nodes or the spleens, they are called lymphomas. Malignant, there's no benign counterpart. The name looks like it's a benign tumor, but it's not benign, it's malignant. Lymphoma is a malignant tumor of lymphoid tissue. Leukemia is a malignant tumor of the blood, WBCs, neutrophils, eosinophils, monocytes, so monocytic anemia, leukemia. So leukemia is the malignant tumor of the white cell. Leukemia means white blood. Leuke means white, emia means blood. So leukemia, because there are so many, normally it's up to 11,000 WBCs in a blood, normal blood. But in this, you can see 100,000 also. I've seen cases, there are 100,000 in chronic myeloid leukemia. So blood looks like white leukemia. Melanocyte, we just saw, nevus and melanoma. Now, placental tissue, a benign tumor arising from the placental tissue is called hydatidiform mole. A special name given by hydatidiform means it has some small structures filled with water, hydatidiform. So we'll see the pictures. Then choriocarcinoma is a malignant tumor of placenta, choriocarcinoma. You have seen, I think you had a case of pregnancy case also. I don't know whether you did the tumors or not. Then embryonic tissue. From the embryo, we know the embryo is a cell which give rise to a baby, fetus, and then baby is born. So it has all type of cells. There are cells which are totipotential. They can make any cells. And a normal embryo can have unipotential cells. They can form only one system, and totipotential cells form many systems. So a tumor arising from the totipotential cells is called a teratoma. Benign tumor, teratoma, it occurs in the testes or in the ovaries. Similarly, it has a malignant counterpart called malignant teratoma. Some people also call it teratocarcinoma, but it's more detailed to see that the malignant compound should be epithelial or it mesenchymal. So we just keep it open, malignant teratoma. Some people call it teratocarcinoma also. If the tumor is arising from the unipotential cells, accordingly, if they are just have potential to make one type of cell, they will have similar type of malignancy. So retinoblastoma is a tumor which forms retina in the babies. Just now, Dr. Fatah was speaking about this tumor, retinoblastoma, retina of the eyeball, of the baby, of the eyeball. I will also mention a little bit. Neuroblastoma, when they form nerves. Nephroblastoma, when they form the kidney tissue. So they are unipotential. Teratoma, we'll see the picture again just now. It's a picture. So quickly going through the
Doctor?
misnomers. Sorry?
What is the mean specific in hydatiform mole? What its
Okay,
meaning in English?
I will tell you just now. We will come to the slide just now. I will tell you again. I told you in a hurry. I know it's not that important, but alhamdulillah, it's a good question. So we'll come to the next slide. So misnomers means they are not correctly named. Malignant tumors, these are malignant tumors, but they sound like benign. People may get confused. So melanoma, it should be benign, but no, it is a malignant tumor. It's so malignant that prognosis is very bad about melanoma. They spread, even they are small in size, they'll go to the brain and the person will die quickly. But lymphoma, we just seen lymphoma is a malignant tumor of the lymphoid tissue, all these lymphocytes and malignant cells. Seminoma, anyone can tell me what is seminoma? It is a malignant tumor of 1, 2, 3. Seminoma is a malignant tumor of the testis. The germinal epithelium of the testicular tissue is called a seminoma. It is also a malignant tumor. Now, teratoma, see, it is a teratoma is coming from totipotential cells, means they can form any tissue. You can see, so it is also common. We see a lot of cases in our practice of histopathology or pathologists reporting diagnostic pathology. We see these tooth. We see a lot of hair in them, skin, all other type of tissues when you cut them. So it is a benign tumor of the totipotential cells, giving rise to many type of tissues. Tumor arising from the placenta. This is the normal placenta. This is the umbilical cord and all these structures. So this is hydatiform mole. They also call it molar pregnancy. Moles means small structures. Hydatiform means full of water. See these, we also call it grape-like structures. When we report these cases, the chorionic villi, you must have done the structure of placenta, I hope, in the pregnancy case. They have the chorionic villi. These villi are filled with water. In this benign tumor, they are filled with water. So they grossly, with naked eye, they look like water, like grapes. So these are the bunch of grapes. You see, like, so they are also called hydatiform mole, or they are called molar pregnancy. The baby will die, of course. This become a tumor, and normally you may find one or two. See, in the normal patient also one or two, few are present as full of water, chorionic villi, only few. This is normal, but when it is too much, then it becomes a benign tumor. So this is a molar pregnancy, or hydatiform mole, means these chorionic villi are filled with water, look like grapes. Is it clear now? Okay, next, thank you. Now coming to the second part. Sorry?
Can you repeat, doctor?
Okay, I'll repeat that this is a normal placenta. You see, placenta histologically is made up of chorionic villi. You should have done it in your pregnancy case structure, if not, but there are villi, small finger-like processes. Some may get hydropic change, degeneration also, like these grape-like structures. See the small inub, okay? All these, but in the benign tumor, there are many of these. They are hydatiform mole, means full of water. These are all full of water, all these grape-like structures. This is called molar pregnancy or hydatiform mole. It is a benign tumor of placenta. It is a benign tumor of placenta, high dendritic form mole or molar pregnancy. Now coming to the cell cycle. Have you done it in any of your subject? Cell cycle. Rami? No, okay. So why the cell they proliferate and divide? Because it's a fundamental requirement. Baby has to grow and then become an adult and then reproduce, etc. So it is important for that. And also, of course, when there's any injury to the epithelium, that's normally cells are dividing and killing. Like we all know that RBC live for 120 days. The lifespan of RBC is 120 days. And all the surface epithelium is all the time dividing and then shedding off. The epithelium of the skin, the epithelium of the GIT lining, the epithelium of the bladder, epithelium of the respiratory tract, they're all the time dividing and falling off. So new and new cells are forming all the time. But some of the cells are not dividing, but they will divide only when there's injury, when there's damage to the tissue, then they will divide and heal. You'll have I think next week, Dr. Ahmed is teaching the healing and repair lectures also. So this is the importance of the cell cycles. You see the cells, there were 4 in the beginning, then they divide, and these are the mitotic figures. You see more in detail, and they divide and divide. There are many small clips. Rami, I will send you by WhatsApp. I've downloaded low quality, and then you can see more in the picture. I don't know if I can, we don't have much time because we have started late. So I'll send you, and then you can send to the students, they can see it. Small videos from the YouTube. There are so many, but I've selected 1 or 2 for you. So what is the definition of cell cycle? The sequence of events that result in cell division is called cell cycle. Sequence of events that result in cell division is called cell cycle. It has many phases. Different people give different names, but we'll try to stick to what our textbook. We know that Robbins is our textbook, so I'll follow that later on. So there are 4 phases in this picture: G1 phase, S phase, G2 phase, and M phase. G1 phase is also called pre-synthetic growth phase. S phase is because of the DNA synthesis. G2 is the pre-mitotic growth phase. M phase is the mitotic phase. So these are the 4 phases, out of which these 3 phases have another name. We'll see next one. Then there are some cells. There are some cells in the body that are not dividing all the time. We know about the liver cell is a good example. The liver cell normally does not divide, but when it is required, it will start dividing. So any quiescent cell, the cells that are not dividing, they are called to be in the G0 state, G0 or D0 state. This is the actual picture from our textbook, Robbins Basic Pathology 10th edition, latest edition. So I wanted to show this important is that this is a G1 phase, and just some cells which are not dividing, they go into the G0. They will sleep there. They are sleeping. They are not dead. But when they are quiet, they come back into the cycle and start growing. So in the G1 phase is the growth phase. There is growth in the mass, and then centrosome duplicate. You see this white spot? This is the white spot is the centrosome, just next to the nucleus. This is the nucleus. This is the centrosome with all these rays coming like sun rays coming out of it. So this is the centrosome. It divides into 2. It duplicates. It divides into 2. And then at the end of the G1 is the restriction point. This is the point when the cell is ready. Say, I want to just divide, but he's waiting for the order from the higher authority. They want, like, is there a race? Everyone is ready on the beginning mark, then there's a fire is done, and the people start running. So this is the restriction point. Everything is ready, and then it goes into the S phase. From G1, it goes into the S phase. But again, before that, before starting the synthesis, there's a checkpoint. This is a checkpoint called G1 and S checkpoint. Here they have to check the system, the cellular system has to check whether the chromosomes, the DNA present in this cell is normal or abnormal. If it is normal, only then it will allow to go into the division. It will not allow the cell to go into the S phase if there is any problem. So this like we go to, for Umrah, there are Nukta Taftish. See, they are checking the people. So here it is checked. The DNA is checked because that's the most important thing. DNA is checked. If it is okay, then chromosome duplication. The chromosome they divide after clearing this exam. This is the first quiz, and then they go into the second semester. Here they are dividing. Now we saw that centrosome is duplicated. Now the centrosome, the white dot here is now 2 from 1, it becomes 2 and goes to the opposite end of the cell. One at this end on the left side, the other go on the right side. So in this process, there's chromosomes are dividing. I hope you all know about chromosomes and chromatid and chromatin, so these are the words. But in the videos I will send you, there it will be very clear because they are movies, they can make you understand, inshallah. So from after the synthesis, again it goes into G2. This is the phase, again it's growing. It is now not dividing. It has completed the synthesis of chromosomes, but now it is not dividing. It is again growing. And then when again it has to go into the mitosis, there is another checkpoint. We know that there are double chromosomes in this, but we have to check that after synthesis, are they okay? So they are checked for any unduplicated, instead of 46 chromosome, they say, oh, I hope they are not 45 or they are not 47. If they are 47, they'll be like Down syndrome. If they are 45, they are Turner syndrome. So they check again for everything is okay. Then it allows to the mitosis. Mitosis is the main picture, which we can see under the microscope, that the cells, they divide, first the nucleus, they divide, the chromosomes, they divide into 2 parts, and then cell division is complete. These are called daughter nuclei, 2 daughter nuclei, and then they keep on going if everything is okay. So this is the picture. Important point in this picture are restriction point and 2 checkpoints. When you look at the YouTube picture, some people have made 4 points also. So don't go according to the book also only. Don't go for other videos on the YouTube. Again, these simple things. Interface. Yes.
After the first checkpoint,
Yes.
if the cell damage complete الcell cycle ولا لا خلاص out.
Okay, we'll come to that, inshallah. The cell is not damaged. We are just looking at the DNA, okay, the molecules. But what will happen to the DNA cell, we'll let you know at the end, inshallah, in the same lecture. I'll tell you just now. So again, it is simple. The interface is the phase in which it is doing its normal work. G1, S phase, G2, and the mitosis, now we are going into the detail. Mitotic phase is of, again, 4 parts: prophase, metaphase, anaphase, telophase. Here I'm trying to explain to you the M phase now detail. So this is the interface in which we all have clumped all these G1, S, and G2 phases here in interface. Now when we start the mitotic phase, the first phase is prophase of mitosis. In this, the chromosomes. See, in the beginning, it was like this. They were just like threads. The chromatin, the DNA is just like threads. We call it chromatin under the microscope here at this stage. We cannot see like this. So this is the chromatin. While it is sometimes open, it is closed, depending on the activity, but it's chromatin. Then after the synthesis, it becomes chromosome. Now they are the X-shaped. This is how the chromosome they look. They are all compact. They are actually divided and they are in 2 parts. They are duplicated after that. And you can see they are attached only in the center. They are X-shaped. The chromosome, they condense, the nuclear envelope now start breaking. And then you see, I told you about these centrosomes. they are at the end, opposite end. They send these tubules. These are like muscle fibers. They will attach to these chromosomes in the center, and they pull them around. They pull them. Pulling, I think, what you call it, ASAP. ASAP, you take the money out from the ATM machine. So that's how they are pulling in the metaphase. The chromosomes line up in the center plane, and the centromeres, they divide and they are pulling apart. When they pull apart in the anaphase, in the last telophase, the chromosomes, they are again now starting to uncoil and the nuclear membrane is formed. Now, some people, they also add a new phase. They call it cytokinesis, because they say mitosis is only up to the DNA and nucleus. They said mitosis means the phases in which the nucleus divides into two, the DNA divides into two. That is mitosis. After mitosis, when the cell divide, when the cell membrane divide, they call it cytokinesis, when the cell membrane divide. So this is a different system according to some people, but doesn't matter much. Inshallah, you will understand slowly and slowly. So again, in the interphase, we have three phases, G1, S, and G2. Here only the chromosomes, initially the chromatin is separate and extended in use. It is doing its work. Liver cell is producing all these enzymes and bilirubin and everything. So everyone is doing its job. Then there is division of the DNA. It becomes double. The chromosomes now start condensing in the mitosis phase. They condense into the X shape. They have double DNA equal, so that two daughters can be formed. So prophase, that spindle is formed. It will pull the two parts separately. Nucleus becomes separate, and then this is how you will see this. Inshallah, in the clips I will send, it will be easy for you to understand, because it's more like a movie thing. It is difficult to explain on this picture. Regulation is important. Again, there are too many things when you must have listened to Dr. Fatah, but I'll just keep it simple. According to my textbook of pathology, not more than that, only what we have been looking at our book. So regulation of anything is two types. You have to increasing or decreasing, positive or negative. Sahi? So the positive control, the progression control of the cell cycle is done by two types of molecules. One are called cyclins, the other are called CDKs. CDKs again, cyclin-dependent kinases. So one molecule is cyclin, the other is CDKs. They are normally present in the cytoplasm. They are not doing anything. They are inactive. They are not doing anything. They are inactive. They will become active only when they combine. When cyclin combine with the cyclin-dependent kinase, only then activity will start. So it all depends how it is done. Is too much detail. We have to remember cyclins combine with CDKs and then activity starts. So this is a simple thing, but more difficult is that there are more than 15 different types of cyclins. There are more than 15 different types of cyclin. I'll try to explain. Just look at this picture. This is again to explain. It's not the real things. Like before the synthesis S phase, suppose, this is suppose, it's not the real name. Suppose there's a cyclin called S cyclin. This is freely moving, not active. There is another CDK called S CDK. Now when they combine, they become active. So here the cyclin S is combining with CDK S, and now they become active, and the synthesis will start. After the synthesis started, cyclin will degrade. S cyclin will degrade and break down. And this is again free, so activity is finished. Now another cyclin will come after the S phase in the G2 phase, which is called M cyclin. Suppose we are just giving our own names. So cyclin M will come, it will combine with MCDK. When they become combined, they become active and mitosis will start, because the name is, to make you understand, is M cyclin. And again, it will degrade and then it will free and activity finish. So is it clear now? So there are two types of molecules, cyclin and CDK. When they are free, they are inactive. They are sleeping. They are not doing anything. When they combine, they produce their activity. and the synthesis starts. But the name is not simple here. There are 15 different type of cyclins. The real names are cyclins are cyclin A, cyclin B. There's no cyclin C, cyclin D, cyclin E, and so on. So they are different types of 15 cyclins. They come, their value increase at different stages. Like cyclin D starts in G1 phase, go up, up, up. The value remains, then plateau, then start coming in the mitosis. Cyclin E, like it will come in the G1, and after S phase, it will come down again. So this is the one, I think this one. Here to explain, we call it S, but it's actually cyclin E. It will only come in the S phase and then disappear. Similarly, cyclin B will come in the mitosis phase. So this is how their levels will come up and down. Their activity will increase and decrease according to the stage of the cycle, the phase of the cycle, their activities are changing. Now,
Doctor,
quality yes?
it's CDK or cyclins, it's enzymes or receptors?
See, this is a name is telling it is cyclin dependent kinases. They are molecules, they are enzymes. If we go into the detail, it will be too much, but just to tell you, they are kinases. Receptors are usually on the membrane, on the cell membrane or nuclear membrane. So they are proteins, they are actually enzymes, okay? So
Doctor,
again,
and
coming to the, what's the
function?
Sorry? See, when they combine, they act on the different cycles. And then if you go into the greater detail, it will be too much. Just remember that when they combine, they become active and produce their effect so that synthesis can occur. And then when this one is combining, they become active and starts, like, just take the example as a driver of a car. These are the accelerators. As a driver at this level, we should know that the job of the accelerator to increase the speed of the car. But we go into detail how it is the benzene is increased, how all this will become too much for you at this stage. Even you can see that these are more like genes, like Dr. Zana must have told you about the BRCA genes. I hope it's too much will become difficult for you at this stage, okay? Just remember when they become
Doctor,
active. Yes.
I have a question. Is M
Yes.
cyclin is the same B cyclin? It active in
No.
meiosis?
No. They are different. Actin and myosin, they are different muscle molecules in the muscles, right? Actin and myosin, you are asking? No, they are different.
No.
This
M cyclin is the same B cyclin in the yellow in the sky.
This
here?
is yellow. The cyclin B is the one which is the same. Here we are just explaining to make first we are making easy to understand that S are for synthesis, M for mitosis. That's all. It is not a real name, just explaining to you, okay? But it's a same act like cyclin B. You are right, mashallah. So the cyclin B is like coming up in the mitosis, just like M is, I explained here in different way. This is the graph, then this is the diagram. This is a pie chart, okay? But how in depth, if we go, it will be too much. As I can see, if you genetics of the tumors, you'll understand the difficulties. You can ask the same question from them, but I don't know, it will become too much for you to understand how they act inside the DNA molecule. They act by acting on histones, etc. Even I'll tell you more about it later on. So these checkpoints, we are coming back to the checkpoints. That here is these are the two checkpoints. They have surveillance system. We cannot say how it works from my lecture point of view. There are surveillance mechanism. They can just see that the chromosome and DNA is damaged. How they see it, I don't think I must have known in detail, and I will confuse you more if I tell you, okay? So there are systems at this point and this point that are just detecting. They are telling the cell that, oh, this DNA is damaged. What we will do, we'll tell you, okay? There is problem in the system. There's problem in the molecule of the DNA, problem in the chromosome. So they are detecting it. So the function is important. Why they are checkpoints? Because if there's any problem in the genetics, they will go and they'll make tumors. They will go and make some abnormal baby after delivery, like Down syndromes and all these syndromes. And Dr. Fatah was telling us Lynch syndrome and so many syndromes. So if there's a problem, they will stop the cell from dividing. What are the different phases? We'll tell you. If so, the no cells with abnormal genetic material should complete a cycle. The function of checkpoint, quality control checkpoint, is to find the DNA which is abnormal. If it is abnormal, first it will try to repair. As Dr. Zainab must have told you, the BRCA genes are repair genes for the DNA. They repair the DNA, the BRCA genes, but if they are abnormal, then they get breast cancer, BRCA genes. Similarly, there are many genes. We cannot go into each detail because that is a different lecture. I think Dr. Fatah can answer you all these. So the quality control checkpoints, when the cells detect the DNA abnormalities, when they do detect the abnormalities or irregularities, the checkpoint activation, the checkpoint will become active. Suppose there's a checkpoint, the Shursar and the Askari are standing, someone comes from the enemies, then they try to fight, they will become active and they'll stop the traffic, okay? So they will stop, they will delay the cell cycle progression. They'll stop it and they'll start the DNA repair system. They'll start fighting the enemies, okay? So their DNA repair system mechanisms are too much. I think these are more of a genetics thing, which you may ask Dr. Fatah. But one I remember from Dr. Zainab's lecture that one of the repair system is the BRCA gene system. And if that is abnormal, then the breast cancer will occur. So there are many DNA repair systems. If they are normal, then everything is okay. But if there's any problem in those DNA repair systems, then many diseases can occur. There, I remember one of the skin disease also, xeroderma pigmentosa. If I start telling you the name, you will get more confused. We just remember if there is damage, then the body has system to repair. If there is a damage or small damage, the body will repair it and the cell cycle will continue. But if the genetic damage is severe, it is very severe and the body cannot repair it. If suppose there's a accident and the car is small damage, they will get it repaired. But if suppose a big damage, car cannot be repaired, they can throw it. So if the damage is severe and cannot be repaired, two things can happen. One is called apoptosis. Anyone heard of this word? Apoptosis? Yes or no? Mashallah, good.
Yes,
So I will not go. Yes, it is a programmed cell death. Body kills its own cell. It is like a suicide. The cell kills. So one thing is that if it cannot be repaired, it will go into apoptosis. Or the other thing, they call it senescence. Senescence means they are just sleeping. They cannot divide, but they remain there. So that is called senescence through many mechanisms by P53. I've just mentioned only this important one or two genes because they are very important. P53 mechanism and how they work, they directly attach to the DNA. That is too much for this lecture, okay? These are all genes. You can ask these questions with the other lectures. Now coming to the negative control. The negative control or inhibition is done by system called CDK inhibitors. CDK inhibitors or CDKIs. So CDK inhibitors it's like a brake in the car. So it will stop the car or stop the cycle through these inhibitors. They are the negative controllers. So how they do it? They just modulate the CDK cyclin complex activity. The activity of the CDK cyclin activity is modulated. They are put a brake to this complex by this method. There are many different families of CDKIs, but our book has mentioned only two, easy for us and easy for your quiz questions. One family of inhibitors has 3 proteins in it, P21, P27, P57. This is a family, one family. They can inhibit many type of CDKs, multiple, different. But there's another family which is special. This special family can only put break on the CDK4, cyclin CDK4 and cyclin CDK6 activity. And this special family has 4 members. We'll see the next picture, then you will understand. The 4 members are P15, P16, P18, and P19. So whenever there's problem in these, this is important. These are the normal inhibitors. They are the normal brake. If the brake fails in the car, there'll be accidents. So if there's any defect in these checkpoint proteins, then what will happen? The DNA damage, the damaged DNA cannot be broken, cannot be stopped, and we find daughter cell, which are mutated, which are abnormal, which can become cancer, which can be at high risk of cancer. Is it clear? So the brake, this is the brake system. The car has a brake system called CDK inhibitors. They directly stop this CDK complex cycling. There are 2 types of brakes. In the car also we have 2 types of brakes in the feet and in the hand brake at the top. So one is the journal family. It has 3 proteins. It has a journal family. It stops all type of CDKs, but a special family which has 4 proteins. It can only stop the CDK4 and the CDK6 proteins. If there is a problem in the brakes, there will be accidents, there will be cancers. This is a good diagram, you see. So here is the special CDK inhibitor, which has 4 proteins. It is acting on the cyclin D and CDK4 complex. See, I told you in the beginning that I was trying to explain that CDKs and the CDKs are numbered as 1, 2, 3, 4 normally. They are not numbered as ABCD. Cyclins are numbered as ABCD. CDKs are numbered as 1, 2, 3, 4, 5 like that. So these are the inhibitors of special, and these are the journal inhibitors. They can inhibit any type of complexes. Is it clear? I hope it is clear.
Yes.
Okay, so this is the inner cycle is the active, the positive control. When they combine, they are making the cell to go, speed, the accelerator. And there are the brakes on the outside. This is the special brakes, only act on a special type of complexes. While these are the common brakes, common family, they can stop any type of complexes. But you can see G1 phase, S phase, G2 phase, and M phase. This is the normal cycle. But here again, we see this is special things in your, this is also a book picture taken from the textbook. That is why I'm telling you. But again, this is the work of the genetics, more of a detail. So we'll quickly go through these 2 important ones. One is the RB protein. As we know, RB is an inhibitor. They try to break, this is the extra system because accelerator is less important, brake is more important. The double system of braking. This is at an inside, very higher level. It is in the depth, direct contact with the DNA. So there are 2 proteins and genes I'm telling you. So they are important in the second brake systems, high quality system. So these are the P53 and RB cell cycle suppressor or inhibitor. They are also the brakes. They stop the cycle. The P53 is so important. They're also called tumor suppressor genes. Now, important thing is that I hope you know the difference between genes and proteins. Genes are the DNA molecules that are responsible for the production of the proteins by the retoplasmic reticulum, like a smooth RER and SER. Sahi? So they are actually proteins. They are doing their job. They are produced through the help of genes, but commonly they are called, just like heart attack is myocardial infarction. So they are usually called genes, but they are actually proteins originally. They are produced by the genes. So there's a little bit confusion. They control the cell cycle at a higher level. P53 is so important. It is called a guardian of the genome. So it is a strong brake. Any small problem, it will stop the cell cycle and make the repair. So if it will directly bind to the DNA to produce proteins that block the progression of the. So it is directly binding to the DNA. How and what molecules are involved, it's not in the level of my lecture, okay? If there's a problem, any mutation or defect in this molecule, there's loss of function, then cancer will occur. Greater than 50% of tumors have p53 defect. So this is so important molecule. It's a protein produced by this gene. They are tumor suppressor gene. Similarly, the retinoblastoma gene is also a tumor suppressor gene. As the doctor was telling, there are proto-oncogenes and tumor suppressor. So this is the breaking genes. So these are the two important ones. Retinoblastoma, which causes a tumor in the eye of the infant, in the retina of the eyeball. Okay, I hope I have not taken long, but it's only now short. I think it's only a revision of the lectures we have done in the pathology, the cellular changes in the cancer. Pleomorphism.
Doctor,
Yes.
is CDK inhibitor and B53 have similar function?
Yeah, function is similar, but the level of function is different.
Yes, B53
Like,
is higher or stronger
yes, it is a
than
more
CDK
stronger. Yes,
inhibitor.
stronger. Yes, yes, yes. If you see the slide, so it's a higher level, stronger one. And that is why you can see that a small problem in P53 will cause many cancers. So it is a higher level. In this picture, I tried to show you this one. That is a higher level. These inhibitors are at the top, outside. But this one is right in the center, the core of the cycle, RB and P53. That is what is according to my book. Maybe it's 5-year-old now. Maybe new things have come. So pleomorphism, you know, pleomorphism, variation in size and shape of cells and nuclei, pleomorphism. You can see this under the microscope. Hyperchromatic nuclei. Hyper means, we know hyper, increased chromatic color nuclei. This is because there's more chromatin in this. There's extra chromatin, irregular chromatin in the nuclei. So under the microscope, the nuclei look hyperchromatic. There's high NC ratio. When you look at the report of pathology, you may see high NC ratio or increased NC ratio, means nuclear cytoplasmic ratios increase because nuclei are larger than cytoplasm here. You see the picture now. Tumor giant cells are present. When in the tumors, there are cells which have many nuclei, many nuclei, multiple nuclei, and prominent nucleoli. Nucleoli are inside the nucleus. Then you see the mitotic figures, which are increased, which are abnormal, which are bizarre. I hope you understand what is bizarre. Very abnormal, you can understand, bizarre. So these are the features of malignant cells under the microscope. These are the cellular changes. So you see, this is the normal cell, lot of cytoplasm, only small nucleus. And here you see in the cancer, the cytoplasm decrease and nucleus is very dark, large as compared, the NC ratio is disturbed. So this is very variably increased nucleus and thick because a lot of chromatin, because now it's cancer. You can see that there are 4 cells and many cells are dividing. These are all mitotic figures. So the many cells are dividing. They are not in the normal organization. We cannot say from where are they, from this surface or from the middle or from the base. So it is disorganized arrangement. And there's variation in the size and shape of the cells and nuclei. And there's loss of normal feature. Here, anyone pathologist can say these are squamous cells. But here we cannot say, is it squamous cells or a basal cells? It's difficult for us to say. It was actually a lot of more detail in it, but you can see what it is. So there's loss of normal feature. You cannot even say, where's the nucleus, where's the cytoplasm, where's cell membrane. So all these are the features of cancer. So this is again a repetition. I think you must have seen this slide, that on the basis of the picture we see under the microscope, we grade the tumors. And here we come to a special word called differentiation. In normal language, different means opposite. Different means mukhtalif, means mufarriq, right? But here is aks. Differentiation means when the cell is extend to the which the tumor cell resembles the cells of origin. If the tumor is well differentiated, that means it's looking like a normal cell. In benign tumors, they are well differentiated. They look like the normal cells. As I gave you the example of lipoma, leiomyoma, and osteoma. So here is a thyroid tissue. If someone asks me what is this, I will say it's a thyroid follicle. It can be a normal thyroid or it can be a follicular adenoma. So they are well differentiated. They are similar to the origin. So the meaning is aks in histology as to the normal speaking. Different is mukhtalif, and here it is same. So malignant tumors can show different levels of differentiation. Grade 1, well differentiated, moderately differentiated, poorly differentiated, undifferentiated. You have, I think you have done grading. That is why I'm going quickly, because lecture has become a little bit long for me. So we divide the tumors according to grade. A well differentiated tumor will look like a normal epithelium. See, this is the squamous epithelium. The tumor is forming here, but still it is just like a normal squamous epithelium. Here it is a bit darker, and you can still see that squams are formed. So it is moderately differentiated. And poorly differentiated means only little bit squamous is left. Mainly they are large, big cells, and you cannot say whether it is squamous only. You can say squamous, but very poorly differentiated. This is a grade 3 squamous cell carcinoma. And finally, grade 4 squamous cell carcinoma, you cannot say what it is. Is it squamous? It is basal? It is sarcoma? It is sarcoma? It's completely undifferentiated. It is not looking like a normal cell, normal tissue. So in such undifferentiated, we use a new term. We call them anaplastic. So remember all these terms, because you may get some quiz question about these terminologies. So anaplastic tumors are the tumors which are undifferentiated, and we cannot say from where it is coming. Is it epithelium? It is the osteogenic, it is chondrosarcoma, liposarcoma. So they are undifferentiated. They have abnormal mitosis. You see all these mitoses are abnormal. See this tripolar. Normally in mitosis of 2, but here you can see 3 tripolar abnormal mitosis. And this is a tumor giant cell. A big cell with 50 or 60 nuclei in it. So this is a tumor giant cell. Alas, I think for the cell cycle, I will send you these small videos. I don't know whether I can run them now. Over. Let's see if I can run this.